Hello, everyone. If you could, please raise your hands if you can hear me.
Oh, you got to stand.
Oh, excellent. Thank you so much. Welcome, everyone, and thank you for taking the time out to come and join us on this wonderful endeavor that we're about to go through with you. We have a few things that we would like to talk about in terms of a new program that we've put together. Oh,
I'm moving you over so that you can be a little more in the middle. There excellent. You go.
So,
there we can see.
Hello, everyone. I'm Dr. Terry Church. I am part of this wonderful endeavor that we're about to talk to you about. And if I could have you come join me over here for just one moment. This is my co-instructor for this day. So if you wouldn't mind.
I'm just Barrington-Trimis. And really excited to have you all here. We are so excited about this new master's program in addiction science that we have been working on for like 3 years, and super excited to get this launched. So I'm going to turn it back to Terry to give you all some information about the program.
Thank you. So just as a show of hands, you can use your thumbs up button or raise your hand in the chat feature. How many of you are currently in the addiction field or thinking of going into the addiction field? Oh, excellent. So a fair number of you. That's wonderful. We are so excited about this joint master's program. So I want to walk you through a little bit about what it entails and tell you a little bit about where we think that you could go as a career afterwards. So this program really started thanks to the Institute for Addiction Sciences, which is a very unique program that brings together a lot of faculty from different schools. I believe it's, what, 18 schools now?
Yeah, something
excellent.
Like that. Yeah.
Excellent. So 18 schools, and there's quite a bit of difference in the way that we approach addiction science, but coming together, we're able to bring those different perspectives to bear and make something very unique and wonderful. Overall, this program was developed as a transdisciplinary and interprofessional approach to the study of addiction. And we have courses that span all of the different schools that are involved, and really are there to expose you to a different perspective of how addiction can be approached and looked at and studied and understood. Our goal for this entire master's program is for you to obtain a really broad and deep understanding and develop skills along the way that will help you, whether you want to go on and do research in addiction or if you want to do clinical care or even counseling. We tend to think of it as a cell to society approach, meaning it covers everything in human nature. Our educational model is a bit unique. So 3 major schools went into creating this program: Keck School of Medicine, the School of Pharmacy, and the School of Social Work. Within these, obviously, you have different perspectives and different looks at how people are thinking about, conceptualizing, researching addiction. And through this, you'll get a unique and very rich experience, I think. With the School of Medicine, what you're looking at is addiction research, treatment, and even policy that you can approach it and look at different aspects of addiction through human health. In the School of Pharmacy, we also have research in clinical care and also regulations and guidelines that are being put out by different organizations throughout the US that we're taking a look at to understand and better approach. And with the School of Social Work, we're looking at things like research, counseling, and supportive care to really help individuals and their families who are struggling with addiction. We have some pretty broad learning objectives. So we prepare graduate students for work in social work or work in pharmacy or even work in medicine, dentistry, occupational therapy, physical therapy, a variety of different healthcare related fields, and also policy. The program is really there to tie together things from preventive medicine, public health, social work, psychology, pharmacology, toxicity, and public policy, as well as health economics. And a lot of this is undertaken through either independent or structured coursework. Part of the program, depending on which area you focus in on, you could do a research track where you really, for example, hone in on some of the health economic aspects of addiction. What is the overall cost to society? How are we accounting for lost hours of work because people are dealing with addiction, for example. When you enter into the program, we have a few goals for you. And among those goals, we want to make sure that we are helping build knowledgeable professionals, making sure that you have the right skills to answer some of the tough questions that keep cropping up related to addiction. You'll be able to compare and contrast different modalities of thought in terms of addiction science, looking at things like laboratory science as well as policy, and weaving those together into a very unique tapestry that will help you understand and treat addiction. We're also looking at ways to implement the science and research that we're doing. So it's not just based out of theory, we're actually looking to make it practical as well. Things that you can apply in your daily life or your future career. We will be incorporating the most advanced knowledge in addiction science from all of these different schools to help you have the tools that you need when you leave our institution. And ultimately, we want to help you develop both professional and ethical skills that you can use anywhere in the world related to addiction science. As far as degrees go, ours is relatively small in the number of units, but it is pretty power-packed in terms of the types of experiences that you'll have. So we have our core coursework, and that is approximately 16 units that you'll need to complete. On top of that, the rest is totally elective. So if there is a set of courses that you're interested in, whether that's health policy or if that's social work, you can focus on those courses to enrich your experience with us. We also have thesis units that we are preparing for our research component. So all of our students who enter into the research paradigm will have to complete a thesis. And our hope is to build up some really good scholarship with this idea. Jess, anything you want to add about the research? Not at the moment? Excellent. So we'll have plenty of time at the end for questions. So if you are really interested in research, by all means, ask us and we're happy to walk you through that. In terms of looking at what your expected progress would be, we've divided it into 2 years, so 16 units in each year. That's about 8 units per semester. And you can mix and match the courses as it fits your schedule. Our goal is to also make sure that we're giving you different types of learning and engagement. So on top of the coursework, we will have, through the Institute for Addiction Science, opportunity for you to attend seminars where you can hear from some of the top researchers in the country as well as worldwide who come and deliver specialized seminars for us. It's pretty easy to go through the program. You could even speed it up if you wanted to. We just have the only requirement that we have is that you are doing well and you're progressing. And as long as you have a B or above, by all means, take as many courses as you can, up to 12 units per semester. So you could speed it up by at least a semester if need be. We've started accepting applications and we have a number that have already applied. And what we've noticed is that we're getting a broad look of students. We're getting people from sciences, we're getting people who are interested in pharmaceutical science, people who are interested in PT and OT. We've even seen some cultural studies individuals. Come on in. Hi, by all means, come on in.
Thank you.
And also healthcare sciences, but we're open to anyone who has an interest in addiction science. The big question that most students ask is, what can I expect when I leave? What type of salaries are available for me? And in doing a really quick and dirty search using some of the most scientific websites possible, Glassdoor.com and other similar search engines, we were able to narrow down a variety of different salary ranges for our students, just to give you a flavor of what it looks like. Now, these are not guaranteed numbers, obviously, and they are representative of a number of different states. California pays more than most states for addiction science related professions, but that is just the nature of the beast. On average, if you just go out into the field working in addiction science without a master's degree, your average salary will be around $40,000. And you'll be doing pretty entry-level things that will hopefully advance your career as time progresses. But you can skip that a little bit by taking on a master's program. And as you can see, we have a minimum range of about 60,000, median range of about 82,000, and a maximum range of 182,000. So pretty wide range, but depending on what you've done in your master's program and how related it is to addiction science will govern how much your salary is. Our goal is to also periodically bring in people who are working in the field to do kind of professional development talks. And we'll do those as seminars so that you get a chance to see the different flavors and feels of what's available and what's out there. This is kind of our big goal, our huge goal, where we want people who've come into the addiction science program to go out into the world and do wonderful things. And we know that people will be engaged in policy and evaluation, research, and think tanks. We have a few here in California that are phenomenal, and we hope that people will start joining those. But you could be using this as a springboard for an advanced degree, your MD, your JD, RMD, or PhD. You could also be using it to get a social work degree, a doctor in social work, or an advanced degree in psychology. Perhaps you're interested in working at a care facility, or being a peer educator, or even working in the pharmaceutical industry itself. Maybe HR or admin is kind of your end goal. But whatever your goal might be, we're here to help support that endeavor to make sure that you are the most successful that you can be in this type of career. Just a little bit about the institute that where we are housed. It was launched in 2018 under the leadership of Adam Leventhal and John Clapp, two very prominent researchers and wonderful people to be around. And they had this vision of putting together an institute where it didn't matter what your academic discipline was. If you were focused on addiction, that's all that really should be concerned. Since the inception, there have been membership from about 80 faculty members. I feel like each month it grows. When I first started and Jess first started, it felt like there were only maybe 30 of us, and then all of a sudden the room expanded to 80 people. And representing 10 different schools, colleges, and hospitals within USC, 17 departments, and we are in the process of outreaching to the community to help build some community partnerships where our students can go and participate and get some internship experience as well. In total, these members that have come from different fields are approaching addiction science in ways that are profound and unique. And together we've developed a programmatic agenda, a strategic plan. We've focused on different areas of growth within the Institute, including education, behavioral and social sciences, just to name a few, as well as a research program. Together, we've formed an organizational structure that has really been wonderful. It's guided us through the past few years and has led to some very unique adaptations within our program. We've made some very cursory engagements into transdisciplinary addiction science. We have a few research programs that are currently running right now, collecting data or soon to be collecting data. We've embarked on training and education. So the master's program that we're talking about today is our second endeavor. Our first was a minor in addiction science among our undergraduates, and we continue to grow and expand our educational footprint as well. And community engagement, which is at the heart of all of this. Addiction doesn't just impact the person who's addicted, but their entire social network. And we want to make sure that we are engaging the communities in which we live and work to bring them to the table. We don't want to just be an ivory tower that is pushing out what we think the world should do. We want the community to tell us what we should be doing. And in total, this is the end of our formal presentation. We wanted to leave plenty of time for questions. As this is a new program, there aren't very many like it in the US, so we wanted to be able to address questions that you may have. So with that being said, I want to thank you for listening to the formal presentation, and we'll open it up for questions. So feel free to take yourselves off mute, type your question into the chat box, and we will gladly answer any questions you may have.
Can you talk a bit about the different tracks that are available?
Sure. So the question was different tracks that we have available in our program.
Here, I'll come up here with you and we can tag team.
There we go. Excellent.
Yeah. So just a quick clarification. So we the program for all three tracks We have a general track, a research track, and a clinical track. And all of them are 32 units. So please excuse the typo on the
Yes.
earlier slide. They're all three of them are 32 units. So with the general track, the idea is a little bit more coursework and less sort of research and clinical work. With the research track, students will take 8 units of research. So they'll spend a whole year actually doing research with somebody in the area of addiction science. With the clinical track, the focus here is more on people who want to be in a clinical field. So a field where they are working with participants or individuals who are struggling with addiction. Maybe they want to go into medicine or pharmacy or social work or something like that. And so the 8 units there will be mostly focused around clinical, the 8 thesis units will be mostly focused around clinical work.
And internship.
And internship, yes.
Definitely.
There's a question from Gilberto Padilla. He's in Zoom.
Excellent. So hold on one second and I will pull that up. Technology is wonderful until it doesn't work for you. So
It's a live question. Go ahead, Mr. Padilla or Dr. Padilla.
Okay, couple of questions. You mentioned that your school is different from other schools. And the other thing is, what is the financial availability for aid to students that are coming to your program?
Yeah, so great question. So I think one of the, we'll start with the first, which is how is this program different? And I think one of the really important differences with this Master's in Addiction Science program is that we are an interdisciplinary program. So most of the time, if there are masters that are in fields related to addiction, there's not another Master's in Addiction Science program elsewhere in the country, but a lot of the other master's programs that address addiction typically are just housed within one school. So you're not getting with a lot of these other programs what we're offering here at USC, which is an opportunity to take courses in the School of Medicine, as part of the actual addiction science program, in the School of Social Work, in the School of Pharmacy. And so because it's an interdisciplinary program, students will receive a lot of additional information from different sides of things, right? When we think about addiction, it's not just all about the psychological addiction part. It's not just about the pharmacological addiction. It's all of these things, right? It's how does this all start? How do we help treat people? How does this develop from a psychological perspective, from a social perspective, from a pharmacologic perspective? And through all of the courses that we have here at USC in the MAS program, students will be exposed to all of that.
definitely. And all of those broad exposures will help you come to the conclusion that we've come to, which is addiction is a very broad-based and complex disease and needs to have approaches from different perspectives.
Regarding the financial aid component, this program goes through USC, through the graduate school there. And so there's definitely opportunity for need-based financial aid, but we definitely encourage interested individuals to reach out to us. We can connect you with the graduate school and talk through some of these additional options.
Definitely. Thank you. So
Thank
other
you.
questions?
There's an online question. Are there any GPA requirements for applying?
That's a great question. So we do follow the university standard. So the GPA standard is set fairly low. It's about 3.0, but we will take exceptions if you have good letters of recommendation and if you have written a really stellar reason for participating, you know, your statement of purpose, as well as some questions that we've developed to make sure that we can align with what your research interests are. So GPA is important as it is a number and quantifies things, but it's not the end all be all. There are exceptions.
Yeah, we're really looking for students from a variety of different backgrounds. You know, we very firmly believe that the best education programs education programs are partly the material that we deliver, but also partly the students that engage and share with one another, particularly in a field like addiction science. And so we really want to have a diverse group of individuals who come and are part of the program, because we really feel like we can learn a lot. We can learn a lot from the students. The students can learn a lot from one another. And we're not just looking for people who have only been in the classroom, who have a 4.0 GPA. We really want individuals from a variety of different backgrounds.
Definitely. So another question that just came in, is the program looking to create a DAS, a doctoral degree in addiction science? Yes, we definitely are thinking that route, but small steps. We had to build one thing and then we can build others. But it's definitely on the horizon. It's something that we will be working with to make sure that we're accredited as well across different disciplines, so that it is a valid degree that you can go out and use for counseling, for example.
Yeah.
Do you want to call it Sharon Velasquez?
Sure.
Yes, please.
Please go ahead.
Karen, do you want to say anything?
So if you have your hand raised for a question, go ahead and take yourself off mute and ask away.
Oh, hi.
Okay.
Can you hear me?
We sure can.
Yes.
Hi, my question is, you mentioned these 3 tracks, general, research, clinical. I know you just did answer part of it, but I'm wondering if you are considering getting approval for this program for people to become licensed or certified as alcohol and drug counselors. I don't know what the regs are in California. I'm calling from Massachusetts, but just because someone has a master's in addiction science, while this
Correct.
program looks really interesting to me, I run a program at a community college that's similar in some ways. Obviously a lower level course numbers, but I'm preparing people for licensure. In Massachusetts, you can be licensed, you can be certified, but certification is a voluntary, licensure is a legal designation. But is that something you're considering in the future? That's one question I have. And another is about recovery. I don't see anything about recovery in here. In other words, we're talking now that there's been a paradigm shift to not totally focusing on treatment, but also talking about recovery, what comes after treatment. The closest thing that you mentioned here is about peer-based, doing peer-based work. But I'm just wondering if you're considering including that or some coursework or that kind of thing. Thank you.
So let's start with your first question. The licensing is something that we have had at the forefront of our minds since we developed this program.
Okay.
And currently, because we have so many different schools involved, pharmacy, medicine, social work, psychiatry, and psychology, one thing that we are doing right now is aligning all of our potential coursework with what the accreditation standards are. And once we have that aligned, then we're going to begin applying for licensure as well as accreditation across the board for all of these different programs. That way we can offer the licensure at the end. So the first cohort might not have it completely because that's a 2-year program, but after that, for sure, definitely we will have it in place. Moving on.
In terms of the specific programs that I think you might be referring to in terms of being like, I can't remember, there's something for tobacco that's like a cessation counselor that is an official license here in California. And we don't have that explicitly as part of our program right now, but that is also something that we've talked about in the future, maybe adding in as an additional certification that those who go through the clinical track could meet. It's currently not part of the program, but this is definitely something that we've talked about and something that we are considering adding for the future.
Definitely.
Great question.
Can I weigh in a little bit too?
Sure.
Go ahead, Adam.
Madam Leventhal. I direct the Institute. I'm also a clinical psychologist. Sorry, I'm getting over a cold, so I sound terrible. So yeah, thank you for your question, Amy. So yes, absolutely. We understand that the coursework and then the internships could be structured in a way so that they take away the burden for students who want to become licensed chemical dependency counselors or go into other types of licensed practitioner routes. I think since our program is so broad and new, and we're thinking about people who, some will become scientists, some will get placed, you know, maybe in the Department of Public Health doing kind of community-wide substance use prevention intervention. Some may already be professionals who are struggling because they're saying they have this kind of, maybe they have a broad mental health practitioner training, and they're seeing all these complex addiction cases because the epidemic's kind of spiraling out of control. Or maybe they're getting patients who are having marijuana use disorder and have kind of questions about, is marijuana good for me? Is it bad? There's so many novel issues in addiction that I think warrant health practitioners to consider getting a science, but also broad focused degree. So it may be that. And what we'll need to do is after we do the first cohort and we see what the needs are, what do people want, right? Because we can't structure the program so that it sets up every possible type of licensure, right? But we may see that there's a very large demand for people who want to become licensed chemical dependency counselor, or what Jess was talking about, a certified tobacco intervention specialist. And so we don't know. And the other thing that we will have is we have a great, what do we call it? Like a student advisor, sorry. And so our student advisors will work individually because this is going to be a small program, right? It might get bigger in the future. And of course, if that's the case, we'll add more staff. But, and so we have a great team and we want to provide a personal touch, and we'll work individually with each of the students, try to understand what their goals are and how we can reduce barriers and facilitate it. If someone says, yeah, I do want to go this particular route, we'll help them with clinical placement so they can get their hours and whatever the specific needs may be. And then I think the issue about recovery and recovery science, yes, it's definitely built into the curricula and our paradigm. And so we have connections with the Recovery Research Institute, Dr. Kelly at Mass General Hospital, who kind of helped bring that science into the next generation. He's not the only one in his group, but and so our Foundations in Addiction Science class, it will be co-taught by myself, who's a clinical psychologist, and Dr. Lewis, who's not on the call right now, and she's a social work. And so, yeah, we will talk about 12-step, right? We will talk about AA-NA. We will talk about pharmacologic treatments. We will talk about maintaining recovery and resilience and what we know about what creates not just abstinence, right, but recovery in a new, mission for that many people who are in recovery experience. So the answer is yes. Thank you for the question. That was really important.
Definitely. And beyond that, we will also be focusing on co-occurring disorders as well. So it's going to be a full gamut of what we're looking into, from treatment all the way through to outcome.
Can you call up Karen?
Sure. So, Karen, you had put into the chat that what is the GPA minimum? Is that the only question that you had? So would you need to retake this for the master's program? Yes, you would, unfortunately, because the core course that we have at the 500 level will be more intensive than it is at the undergraduate level.
Yeah, so it's a different course. It has a similar name, but it is a different course, the master's level course compared to the undergraduate course. But we're really excited to have you in our course next semester.
Definitely. Other questions, please go ahead and take yourselves off mute. and ask away.
In regards of certifications and everything else that you guys say, and one thing that I've been hearing most often is that this is the first cohort in regards of addictions. What would be some of the situations that I might encounter? Like you said it later on, we'll probably be adding those, but me getting the master at this time, later on, will I have an opportunity to kind of come back and retake some of those things that you add to the program, or I'll just be, whatever you got from this program was the first experience and move on and enjoy your career? Because sort of the way Amy brought out a big question when it comes to certifications and licensure, especially here in California. You have to be certified in some instances to be able to provide services. And it's sort of the way you guys say, well, we are interactional with other departments, but yet you're not covering the legalities of it.
So we will be developing certificate programs afterwards to go in tandem with the rollout of these things. So if you've graduated already with the master's program, you can come back and take the certificate, which will then help get you certified.
Yeah, if there's other certifications also that students are interested in, I mean, this will be a good opportunity. Our student advisor can definitely work with you. For example, if you want to go out and get the tobacco intervention specialist certification, we can direct you to sort of what the programs that are available for that. And we're happy to sort of help in that way. And of course, we want our alumni to come back, which would be fabulous as well. And and we'll keep our alumni apprised of sort of how the program changes and grows. But I think even with this first cohort, we have a really exciting menu of classes to take. We have really great foundational courses that will really cover a lot of the key issues in addiction science to provide a knowledge base that can be used in sort of whichever field our students go into.
Definitely. And we also have the flexibility with our directed research units where if you need to go out and take a course outside to get that certification, we can apply that course through our directed research units to apply towards your degree as well.
Yeah, and there is a saying at USC: once a Trojan, always a Trojan. So yeah, we generally alumni are very involved across the board with all of the different educational programs across the entire university. So we plan to be no different, and we want to maintain a positive reputation too. So we don't want to be sending our alumni out and say, "Sorry, you're done. We wash our hands of you. That's it." That's not what we want to do. We're interested in improving the lives of our students, and then we want our students to go out and be poised to make an impact on the community and on society, right? And so,
definitely. And you're looking at 2 alumni right now. Excellent. Other questions? So I saw the comment about removing the word abuse from one of our courses. So we do have that in the works right now. Unfortunately, with our curriculum program, it takes a little while to get these things changed, but it is in the works.
Yeah, great comment. Other questions we can answer from any folks?
Is this a fully, campus-based
Great
master's
question.
degree?
Great question. So it will be taught in hybrid. So portions of the class will be in person on campus and others will be online and available online as well, synchronous and asynchronous.
Yeah, it really just depends on the course. For a lot of the existing courses, if they're currently in a hybrid or on campus only format, that's the format that our students will take as well. And all of the ADSC courses are going to be taught in person on campus, and we always have the remote option if folks are sick. The lectures will be recorded and whatnot, but it is primarily right now an on-campus program. We are looking into, in the future, potentially adding an online-only version of the degree program, but we don't currently have that available right now.
Can I ask the program directors a question? So like, what if there was someone who lives in Massachusetts, right? And they wanted to enroll in the program, but they didn't want to move, obviously. Could they live in Massachusetts and attend all the live Zooms and maybe fly out for, I don't know how many, times that would be expected? Could they kind of like, could they telecommute this?
We would have to address that on a case by case basis and a student by student basis, for sure.
That makes sense. I mean, and also like the directed research, if someone's going to be doing like bench work, they would have to be in here. But if someone's doing epidemiology and, data analysis, then they wouldn't necessarily need to be in LA.
Yeah, there's also an opportunity too, if somebody were working in Massachusetts and had an opportunity to do work with a group in Massachusetts, that could also be a part of the thesis units. But yeah, so we definitely on a case-by-case basis. Again, we're really, we're moving forward with this first on-ground cohort of students, but definitely have plans to expand to an online version of the program in the future to exactly so that we can accommodate people wherever they are living.
Definitely.
May I ask another question?
Sure.
This is going to be sort of more like philosophical or, I think this is wonderful what you're doing, and I find it very exciting as someone who's worked both in the addiction treatment field, doing clinical work for a number of years, and now I work in higher education, training students and educating students in addiction studies at Greenfield Community College in Massachusetts, preparing them for licensure. So these are primarily associate level students, but I do get bachelor's students that come here specifically to get the certificate. It's a certificate program. But I'm sort of wondering, like, and maybe I'm just putting you too much on the spot and you can just tell me to shut up, but, but like, what is your philosophy? Do you know what I mean? Like, why this, why now? I mean, sure, we could say there's an epidemic, but there's been an epidemic really forever, depending on what substance you're talking about. So what's your philosophy? I mean, I know, I guess I can't say, what do you think addiction is? Because that would be a bit absurd. But I guess I'd like to hear that part of it if you have any response. Thank you.
So that's a great question, and thank you for asking it. It's one that we definitely ponder quite frequently among ourselves and in our education committee anyway. So why don't you go ahead and give your philosophy and I'll give mine, and then we can see if it matches and where we go from there.
Sure. Do you want
I'll
to start?
I'll be third then. Okay.
Excellent.
Okay.
You tie us all together. From my perspective, there are two diseases that every American family will face, and that's cancer and addiction. And if we don't treat both of those, we're doing a huge disservice to the people that we are in community with, that we teach, that we interact with. And for me, addiction truly is something that is manageable and can be manageable, but it needs to have appropriate research done, and it needs to identify that there are people involved, and it's not just a clinical outcome. So for me, it's more of a personal approach to making sure people understand what addiction is, and that we move away from that criminal element that has so long pervaded the US and move it more towards a public health paradigm where we're actually seeking out treatment for people in addiction and recovery. So that's my personal philosophy on it.
Yeah.
What's yours?
Yeah, I think I'll address also the timing of this program too. So I've been working in addiction for a while. I'm an epidemiologist, and I do a lot of research, mostly on young people, mostly tobacco and cannabis, although we've done some work in some other substances as well. And I should mention also, my husband is a criminal defense attorney. So we do very different things, but a lot of the individuals who experience addiction, I mean, he sees a lot of individuals as his clients who are working through addiction. And we study it, I study it with my research team as well. And so that sort of was the first, like, there's more than one side to addiction. It's not just what's the epidemiology of addiction, but there's so many different facets to it. When the Institute of Addiction Science started back in 2018, for a little over 4 years ago, it was an opportunity that I think really exposed me to individuals from other fields. It was through the Institute that I met Terry and learned more about the pharmacological side of addiction. Also met Jen Lewis, and we had really great conversations from her social work perspective. And I think for me as an individual and continuing with my research, that additional just idea that it's not like just epidemiology in my training, but also what are we doing to incorporate these other fields? What are we learning about these other fields? That really kind of opened up the way that I thought about addiction as a whole. And I think through these conversations, that is really what led us to start thinking like, hey, this is such an important thing that students are not getting, right? So you go through an epidemiology program or a clinical psychology program or, whatever program you do, and these programs are all tend to be just that field, right? And so reflecting on how important and how eye-opening it was to just learn about the addiction from other people's viewpoints really got me excited about developing educational programs to ensure that students who are going into an addiction field, whatever field that is, that they are exposed to not only the one siloed area that is maybe their primary area of interest, but that they get viewpoints from other things collectively. And so that was sort of how the birth of the educational programs came about, is us thinking like, we gotta, like, this is such a great collaboration. Everybody needs to know about addiction from different perspectives. We have to start something from an educational perspective to help our students.
So Adam, if you'd like to take us home.
Well, sure. Yeah. The very, very well said. And yeah, I mean, addiction is the number one public health and social problem that we have. So the number one cause of early death is smoking. And that's just one little small segment. And as part of this program and part of our institute, we're interested in all addictive behaviors, even social media addiction and those types of behaviors. So I think, the timing is right. The timing is now. The policies are changing, and the people who are on the supply side of the addiction problem, whether it be Philip Morris, Anheuser-Busch, or the cartel, they're going to continue to evolve. They're very smart. And so this isn't like a kind of, we're going to identify a treatment like a vaccine. This is a multifaceted problem that we need to hit through policy change, social programs, medications for some, counseling and whatnot, and prevention. So that, I think, is the main impetus for this program. And the other thing that we want, this is addiction science. We want everything to be evidence-based. And what got me into addiction, honestly, is not to help people. It is now, right? But come on, addiction is so interesting. It's the ultimate expression of a paradoxical behavior, engaging in a behavior that is bad for you and bad for others, but you can't stop, right? And so it's just fascinating way, it's a fascinating example to learn more about human nature, the way the mind works. And we hope that the students will appreciate the intellectual aspect of studying addiction. And with that, I believe that people who are out there in the real world making change are going to be much more equipped to handle a number of different types of issues. I'll get off my soapbox.
No, thank you. Does that help kind of frame where we're coming from?
Yes, thank you. Thank you very much.
Definitely. So we have a little bit of time left and we're happy to answer any additional questions that you may have. We are recording this, so we will try to make this available if you want to come back and take a look at it later on. We'll send out the link to everyone who's signed in, but I think we'll also put it on the website. Yeah, definitely.
And if you have questions, please reach out. You can reach out to me or Terry. You can reach out to our program administrators. It should be relatively easy to get a hold of us. I think Vicki put Jill's contact info in the chat. And so we're happy to answer any questions, even if stuff comes up, a couple of weeks from now, reach out.
Definitely. Don't be shy.
Question for estimated cost.
And spread the word.
Yes, and spread the
please.
word, please.
Yes.
So the estimated cost, we would have to take a look at it, but I believe it's around 20 to 30, or if not more.
50 to 60,000 total
Yeah.
for the program.
Excellent.
Yeah.
Yeah, so that sounds about right.
Yeah, we're happy to reach out back channel and we can get you some more accurate information.
Definitely. Awesome.
All right, well, if no further questions, we will let you all get back to your day. Any last comments or questions before we leave you all? Okay, thank
Awesome.
you so much for joining us today. We are very excited about this program. We will probably do some other information sessions later on. The application deadline for early admission is February 1st of next year, and the final deadline is in May 1st for regular admission. And again, if you have any questions, please don't hesitate to reach out.
Definitely. And thank you for taking the time out today to join us.
Okay.
Thank you.
Have a good day.